all the continents of the planet, the infection ceased to be improved and become by local transmissions. These are some examples of diseases that have crossed the globe, how they have been fought: smallpox, yellow fever, and COVID-19. Now, we're going to continue with our partner, Alexa.
What governments did to combat pandemics? Plague of Justine that 8 centuries later became the Black Death. Doctors and medicine were unprepared to fight disease on the 14th century, so they burned aromatic herbs to purify the environment or they used sulfur to fight air pollution. The only measure that managed to be useful at the time was the burning of clothing, floors, and carpets, because the transmission from animals to humans by fleas was from animals to humans from sick people and oil from pickpockets. Most pandemics have in common attacking the respiratory tract, dealing with them with most confinements, closing of public spaces, social distance, and good hygiene. For this, science will have to be one step ahead of any disease. With innovation and collaboration, it will be possible to combat any disease through vaccines, antibiotics, and treatments.
Thank you, Alexa. Now, can you tell us what do you think about what you read?
Yes, I think that they eradicate the disease as they could. Medicine and experience did not help at all.
Okay, thank you. Now we're going to continue with Gabriel.
Consequence of pandemics in people. One of the secondary effects on the health of the population, but which in most cases did not translate into more demand for health service, is emotional impact. A research carried out at the beginning of preventive and compulsory social isolation in Argentina found that the concept most frequently mentioned by people were those of uncertainty, fear, and worry.
Thank you, Gabriel. Now, can you tell us what do you think about what you read?
My opinion on my topic is that pandemics affect both physical and emotionally, but I think that the health sector could also focus on the emotional part and not only on the physical side.
Okay, thank you for your information. Now we're going to continue with Mariana.
Is there a chance that disease will return? Yes, there can be low infection of disease with what probably a pandemic can cause a new pandemic. Since disease and infection may be separate, like measles or chickenpox, it will always be there, but they don't spread that much since there is treatment and vaccines. Human users and it already know how to treat. The majority of the world population is still sustainable, which means that epidemics can easily return and there will be large outbreaks again. The virus can be remitted by change or coupled to the change of climate, or the vaccine was not ever effective.
Thank you, Mariana. Now, can you tell us what do you think about the probable return of pandemics?
My opinion is that pandemics will return. We know so many infected since there are vaccines and health measures.
Okay, great contribution. Now we're going to continue with Janet.
A pandemic affects us nationwide. It's not just a national problem, but a global one. For this reason, there is not possible intervention to avoid an economic contraction at a greater level. The demographic decline is palpable, as in the family and social breakdown, with the country's economic crisis that is brings in several places. The country's productive capacity was destroyed. In addition to this, the number of migrants increases. Several countries do not have health savings. In a pandemic, we are exposed to becoming infected so that it does not spread. We must help measures. On several occasions, they have to be refugees to avoid contagion or expansion, to achieving that the pandemics end.
Okay, now can you tell us what do you think about the damage that pandemics have generated over the years?
My opinion is that pandemics have left many crises that harm the population or the economic and health.
Okay, thank you. Now we're going to continue with Dana.
Thank you. First, the Black Death was the most devastating pandemic in human history and was active 3 times, causing more than 250 million deaths. This disease is caused by the bacteria Yersinia pestis carried by rodents. In 1520s, when the Spaniards arrived in America, they brought smallpox, a disease caused by the variola virus, which was very deadly in those times, and soon spread throughout the new territory. It wasn't until the 1970s, when the vaccine was created, that the virus was eradicated. More than 450 million people died. In March of 1980s, in the last months of the Second World War, the first case of Spanish flu was registered in a hospital in the US. Between 50 and 100 million people died. The first cases of acquired immunodeficiency virus were in 1981, and since then it has spread throughout the world. It is believed that its origin was animal and its effects is the depletion of the immune system, so that the virus is not lethal, but its consequences are. It is estimated to have caused around 25 million deaths. Thank you.
Okay, thanks for your contribution, Dana. Now we're going to continue with Luciana's information.
Hi, Jimena. Consequences of pandemic in history. Pandemics are like natural disasters. Wars and famine decrease the number of living of human beings. The entire population are ruined, health services are collapsing, panic, insecurity, and mistrust spread to the rest of the population, giving rise to rumors of all kinds that only cause more confusion and chaos. The number of migration increases as people flee from one country to another trying to escape the calamity.
Okay, now can you give us your opinion?
Yes, of course. When a pandemic happens, communities that are poor or do not have the necessary resources become more impoverished since they take up many health resources. People get sick and also can die because they don't have the necessary money for buy food or medicine that they need. And we can help people and poor communities with something. Thank you.
Thank you. Well, thank you for seeing us. We hope this topic has been understandable and to your liking. And bye.